It's fascinating how physicians can swiftly identify significant health concerns merely by observing specific hygiene errors in their older patients. These seemingly benign habits may be quietly signaling the emergence of perilous conditions within your body at this very moment. What is genuinely alarming is that the majority of seniors remain unaware of the critical mistakes they commit on a daily basis. In just a few moments, I will uncover the 7 personal hygiene missteps that physicians often observe in their elderly patients, and how addressing these issues could potentially save your life or the life of someone dear to you. The insights I am about to reveal are seldom found in educational institutions, infrequently addressed in medical consultations, and almost never highlighted in wellness publications. It may very well determine whether you spend your golden years in vibrant health or endure avoidable ailments that strip away your independence and dignity. Allow me to introduce you to Harold, a 75-year-old retired engineer who believed his personal care routine was just as it should be. Harold engaged wholeheartedly in his community, swung his clubs on the golf course twice a week, and was always present to cheer for his grandchildren at their baseball games. What Harold believed to be a mere routine checkup took an unexpected turn when his doctor swiftly identified 3 significant hygiene errors, uncovering that he had been unknowingly nurturing a serious condition for months. What Harold later confided in me, expressing his surprise. I believed I was tending to my well-being with diligence. Had my doctor not observed these seemingly trivial hygiene concerns, I may not be here today to share my tale. Today, I will reveal the specific mistakes made, allowing you to steer clear of Harold's alarming ordeal. However, what truly matters is that I will guide you on exactly what steps to take. Easy adjustments that have the potential to extend your life beginning today. Error number 1. When was the last time you truly examined your toothbrush? Is it tattered and faded? Do you ensure a thorough brushing twice each day? Now, let us turn our attention to the question of greater significance. Are you aware that inadequate dental care extends beyond mere bad breath or the loss of teeth? It is intricately connected to heart disease, stroke, and even dementia. Researchers at Harvard Medical School have demonstrated that bacteria stemming from untreated gum disease can infiltrate your bloodstream, potentially leading to severe heart conditions. Indeed, their findings reveal that older adults with inadequate oral hygiene face a 3-fold increase in the likelihood of developing cardiovascular issues compared to those who uphold proper dental care. However, I encourage you to seek your own understanding. Allow me to introduce you to Sylvia, a 68-year-old retired school teacher hailing from the picturesque state of Oregon. Sylvia turned a blind eye to her bleeding gums for months, convinced it was a common occurrence for someone her age. "I suppose that's simply the way it goes as one ages," she remarked. During a routine physical, her cardiologist uncovered alarming inflammation in her heart valves, a direct consequence of oral bacteria that had journeyed through her bloodstream. The doctor warned her that had she delayed her visit by just a few more months, the damage could have been irreversible. So what steps should you take at this moment? Begin by scrutinizing your toothbrush. Should it exceed 3 months in age or exhibit any signs of wear? Replace it without delay. Ideally, transition to an electric toothbrush, as research from the University of Pennsylvania Dental School indicates it removes 62% more plaque than manual brushing. Brush twice daily for a complete 2 minutes each session. Consider setting a timer if necessary. Floss diligently every night without fail and ensure you never miss your dental checkups, regardless of whether you wear dentures. Have you observed any bleeding while brushing? Any swelling in your gums? These are not typical indicators of aging. These are the warning signals your body is sending. Do not disregard them for another day. Mistake 2. Infrequent bathing and skin care. How often do you bathe? Be honest with yourself. As individuals age, it is common for many seniors to decrease the frequency of their bathing rituals. However, it is essential to recognize that the skin, being the body's largest organ, can serve as a window into one's overall health. Dermatologists at the Mayo Clinic caution that this reduction in bathing can obscure early indicators of significant health concerns, such as diabetes, liver dysfunction, and cardiac complications. Their clinical research indicates that nearly 40% of undiagnosed medical issues in elderly patients might have been identified sooner with vigilant skin observation. Reflect on the experience of Clarence, a 77-year-old retired postal worker hailing from Michigan. He believed that bathing once a week was adequate, particularly during the winter months when the dryness of his skin became more pronounced. He expressed his concern about drying out his skin. However, During a visit for an unrelated issue, his physician observed unusual skin discoloration. Subsequent tests uncovered early-stage kidney disease, indicating that the discoloration was not a result of inadequate hygiene. Infrequent bathing concealed a vital symptom that might have been detected weeks prior. What is the remedy? Implement a consistent bathing routine, aiming for at least 3 times a week, regardless of your activity level. Opt for gentle, fragrance-free soap that preserves your skin's natural oils. Following your bath, gently apply moisturizer to your skin while it retains a hint of moisture, ensuring that hydration is sealed in. Equally crucial is the practice of routinely inspecting your skin for any unusual shifts in color, texture, or sensation. Are you observing dry, flaky patches, uncommon discoloration, persistent areas of itchiness? These signs may serve as your body's subtle signals, indicating that something more significant could be occurring beneath the surface. Do not let another day pass without acknowledging these warning signs. Mistake 3. Neglecting nail care. Pause for a moment and examine your fingernails and toenails. What do you observe? Are they well trimmed, clean beneath, and devoid of discoloration? The state of your nails serves as a reflection of your overall health, something physicians assess promptly when evaluating elderly patients. The American Academy of Dermatology reveals that alterations in nails can signal more than 20 distinct systemic diseases, ranging from anemia to thyroid disorders and heart disease. Their findings indicate that among patients over 65, nearly 30% of those with nail abnormalities were diagnosed with previously unnoticed internal conditions. Allow me to recount Beatrice's story. At 82, Beatrice regarded her thickening, yellowing toenails as unremarkable. She merely opted to forgo sandals, concealing them within closed shoes. "I thought it was just part of getting older," she confided to me. Upon visiting a podiatrist for her persistent foot pain, she was swiftly diagnosed with a fungal infection that had thrived unchecked, exposing the fragility of her immune system. Additional tests unveiled a grave underlying condition that necessitated prompt intervention. What steps can you take today? Ensure you trim your nails consistently, cutting them straight across with gently rounded edges to avert the risk of ingrown nails. Maintain cleanliness and dryness. Opt for breathable footwear and ensure a daily change of socks. Always pay attention to any alterations in nail color, texture, or thickness. These are not mere cosmetic concerns. They are potential signals from your body. Are your nails brittle, discolored, or thickened? Such changes are not unavoidable aspects of aging. They are your body attempting to communicate something significant. Will you heed this message before it's too late? Mistake 4. Inadequate incontinence management. This is perhaps the most startling hygiene oversight due to its prevalence and the lengths to which individuals go to conceal it. More than half of seniors are quietly grappling with various forms of incontinence. Yet, the most startling revelation is the number who choose to conceal their struggles rather than pursue appropriate care. Experts from Johns Hopkins Medicine warn that neglecting this issue can result in severe skin infections, increased risk of falls, social withdrawal, and may even obscure grave health concerns such as bladder or prostate cancer. Research indicates that older adults who effectively address incontinence challenges experience 60% fewer complications compared to those who try to conceal the issue. Consider Douglas, a 73-year-old retired accountant from Arizona, died. He felt too ashamed to bring up his occasional leakage with his doctor. He relied on paper towels and changed his clothes often, convinced he was handling the issue. However, when he eventually sought assistance after the emergence of painful sores, doctors uncovered an advanced prostate condition that could have been addressed months prior with far more favorable results. "My pride nearly cost me my life," Douglas confessed. "Regret lingers in the mind as I reflect on the moments I hesitated to speak with my doctor at the first hint of trouble, opting instead to conceal my concerns." If you find yourself grappling with any type of incontinence, remember this: there is no shame in bringing your bladder issues to light. Your doctor encounters these matters daily, and they are there to help you. Utilize appropriate absorbent products crafted specifically for incontinence, steering clear of improvised alternatives. Ensure timely changes when damp and adhere to a thorough cleansing regimen to avert skin deterioration. Above all, understand that incontinence should not be regarded as a typical aspect of aging. It frequently signals that medical intervention is necessary. Are you noticing intermittent leakage? Do you find yourself organizing outings based on restroom access, resorting to improvised protection? Don't hesitate to consult your doctor about these concerns. Your well-being, and perhaps your very existence, could hinge on it. Mistake 5. Ear hygiene errors. What does your ear cleaning routine look like? Take a moment to reflect. Are you reaching for cotton swabs and pushing them deep into your ear canal? If that's the case, you're falling into a perilous trap that countless seniors encounter daily. Many older adults risk their hearing and overlook critical signs of serious infections because of improper ear cleaning practices. Otolaryngologists at the Cleveland Clinic caution that elderly patients frequently harm their ear canals with cotton swabs, overlooking signs of potentially serious infections. Their findings indicate that improper ear cleaning accounts for nearly 40% of ear canal injuries in individuals over 65, with numerous instances resulting in infections that could have been entirely prevented. Allow me to introduce you to Patricia, a 71-year-old retired librarian from Washington. Patricia had a habit of using cotton swabs to delve deep into her ears, a routine that took a dire turn when she accidentally punctured her eardrum. This misstep resulted in a painful infection that spread to the surrounding tissue. "I always cleaned my ears this way," she recounted, a hint of disbelief in her voice. "No one ever warned me it could be dangerous." Patricia found herself in need of urgent medical care, resulting in lasting hearing impairment that was entirely preventable. What is the proper method for maintaining ear hygiene? Keep this straightforward guideline in mind. Never place anything smaller than your elbow into your ear canal. Gently cleanse the outer ear using a warm, damp washcloth. Should you suspect an accumulation of wax, consider employing ear drops formulated to soften it, adhering strictly to the instructions provided on the packaging. Seek medical attention without delay if you encounter pain, discharge, or alterations in your hearing. If your ears are itching, feeling full or blocked, and you're noticing unexplained changes in your hearing, it's crucial not to try to fix these issues on your own. Such matters demand the expertise of a medical professional. Your hearing is invaluable. Safeguard it with diligent attention. Mistake 6. Neglecting foot hygiene. When did you last take a moment to truly examine your feet? Not merely a fleeting look, but a meticulous scrutiny of every inch, from the spaces between the toes to the heels and soles. Your feet hold essential insights into your circulatory and nervous systems. Often the first area doctors assess in older patients. Podiatrists focused on geriatric care at the American Podiatric Medical Association emphasize that issues with foot hygiene frequently unveil the initial indicators of diabetes, neuropathy, and vascular disease. Research indicates that among patients aged 65 and older, diligent foot care and routine examinations could avert as much as 85% of amputations linked to diabetes. This is not an error. A staggering 85% of these amputations could be avoided through appropriate foot care. Picture Raymond, a 76-year-old retired factory worker hailing from Illinois. He brushed aside the dryness and small cuts on his feet, convinced they were merely the typical markers of aging. "My feet had been looking rough for years," he confessed. However, when his doctor observed them during a routine examination, he promptly requested diabetes testing, identifying the condition in its early phases, when lifestyle modifications could still yield considerable impact. "If my doctor hadn't examined my feet, I could have gone years unaware of my diabetes," Raymond shared with me. "By that time, the harm would have escalated significantly." What actions should you take from this day forward? Clean and completely dry your feet each day, paying particular attention to the spaces between your toes, where fungus tends to thrive. Regularly examine them for any cuts, sores, or alterations in color or temperature. Don fresh, dry socks crafted from natural fibers or moisture-wicking materials. Smooth on moisturizer to parched areas, steering clear of the spaces between your toes, and always heed the signals of pain, numbness, or wounds that refuse to mend. Seek the expertise of a medical professional without delay. Are your feet exhibiting dryness and cracks? Have you observed any cuts that seem resistant to healing? Is there any unusual discoloration or a loss of sensation? These concerns extend beyond mere aesthetics. They may serve as early indicators of significant health issues that require prompt intervention. Mistake 7. Hygiene complications linked to medication. Are you currently on multiple medications? Have you detected alterations in your body odor, perspiration patterns, or dryness in your mouth since commencing them? The very medications that sustain your life could be contributing to hygiene challenges that may indicate perilous side effects. Pharmacologists at the American Geriatric Society have meticulously documented the ways in which certain commonly prescribed medications can lead to dry mouth, excessive sweating, or alterations in body odor that may signal potential toxicity. Their research reveals that nearly 40% of adverse drug reactions in seniors manifest initially as shifts in personal hygiene needs, often preceding more severe symptoms. Consider Barbara, a 67-year-old retired nurse from Florida. Barbara's peculiar body odor was brushed aside by her family as a mere issue of hygiene until her geriatrician identified it as a symptom of medication toxicity that was gradually harming her liver. "I was showering regularly and using deodorant," Barbara recounted. "I had no idea the smell was emanating from within my body, not from a lack of cleanliness." How can you safeguard your well-being? Monitor all hygiene alterations that arise after beginning new medications. Maintain a straightforward journal to record any variations in body odor, perspiration, dryness of the mouth, or changes in your skin. Ensure you stay adequately hydrated unless directed otherwise by your physician. It is crucial to report any unusual sweating or changes in odor to your doctor without delay, as these symptoms may signal serious drug interactions. Additionally, never alter your medication dosages without professional guidance, even if you suspect the medication is affecting your hygiene. Have you observed any peculiar body odor despite maintaining a regular bathing routine, or experienced excessive sweating and extreme dryness in your mouth? Do not dismiss these changes as mere signs of aging. They may be alerting you to medication side effects that could pose serious risks and require prompt action. You are now aware of the 7 crucial hygiene errors that physicians often observe in their elderly patients, along with precise methods to rectify them. By tackling these concerns today, you can avert significant health complications, uphold your dignity and autonomy, and possibly extend your lifespan. Keep in mind that maintaining proper hygiene transcends mere aesthetics or social niceties. It plays a crucial role in safeguarding your health as you grow older, and implementing these straightforward adjustments could genuinely be life-saving. If you found this insight beneficial, consider giving it a thumbs up at this moment. Have you ever had your doctor point out any hygiene concerns during your appointments? We invite you to share your experiences in the comments section below. Remember to subscribe and activate the notification bell to stay updated on more crucial health information. Also, consider sharing this video with your loved ones who are over 60. This knowledge has the potential to be a matter of life and death.